Multiple sclerosis is a condition that affects the central nervous system, causing symptoms such as vision problems, fatigue, numbness, and muscle weakness. It happens when the immune system attacks the protective layer around the nerves in the brain and spinal cord, causing damage and disruption to the nerve signals. Multiple sclerosis can be hard to diagnose because the symptoms vary from person to person and can come and go. However, there are some early warning signs that you should never ignore, especially when you have more than one of them, as they may indicate that you need to see a doctor for further evaluation. So here are 7 of these early signs. 1. Optic neuritis. This is inflammation of the optic nerve that can cause blurred vision, pain in the eye, or loss of color vision. Optic neuritis is one of the most common early signs of multiple sclerosis, affecting about 50% of people with the condition at some point. 2. Lemmit Sign. This is a sensation of electric shock or tingling that runs down the spine when you bend your neck forward. It can also affect the arms or legs. Lemmit Sign is caused by damage to the spinal cord and can be a sign of multiple sclerosis or other neurological disorders. 3. Numbness or tingling. This is a feeling of pins and needles or loss of sensation in any part of the body, especially the face, arms, legs, or feet. Numbness or tingling can be caused by many factors, such as poor circulation or nerve compression, but it can also be a sign of multiple sclerosis if it lasts for more than a few days or affects multiple areas. 4. Fatigue. This is a feeling of extreme tiredness or lack of energy that does not improve with rest or sleep. Fatigue is one of the most common and disabling symptoms of multiple sclerosis, affecting up to 80% of people with the condition. This type of fatigue can interfere with your daily activities and quality of life, and can be worsened by heat, stress, or infection. 5. Cognitive problems. These are difficulties with memory, concentration, attention, or problem solving. Cognitive problems can affect up to 65% of people with multiple sclerosis and can range from mild to severe. Cognitive problems can impact your work, education, and social life and can be frustrating to deal with. 6. Balance and coordination problems. These are difficulties with walking, standing, or moving smoothly. Balance and coordination problems can be caused by damage to the cerebellum, which is a part of the brain that controls movement and coordination. These balance and coordination problems can increase your risk of falls and injuries and can affect your mobility and independence. 7. Spasticity. This is stiffness or tightness of the muscles that can cause pain, cramps, spasms, or difficulty moving. Spasticity can affect any part of the body, but is more common in the legs. Spasticity can be triggered by cold, heat, infection, or stress, and can limit your range of motion and function. If you experience any of these early signs of MS, you should not ignore them or explain them as normal aging or stress. If you have more than one of these signs, you should see your doctor as soon as possible for a thorough evaluation and diagnosis. This is because early treatment of multiple sclerosis can help slow down the progression of the disease and reduce the severity of the symptoms.